Thank you. So I hope everyone's recovered after the last very interesting session, is ready to hear something else. So I thought today I'd just tell you a little, there's so much to talk about in terms of unmet needs, but I thought I'd tell you a little bit about the research I've been involved in the last few years. If I can figure out how to get this to work. Okay. So I want to specifically talk about unmet needs, and when I talk about needs, I'm talking about something that's a specific issue that people need help with or want help with, whether it be a resource or an action. And I'm talking about something slightly different from quality of life and satisfaction with care, which I'm sure you've all heard people talk about ad nauseum. With quality of life, we really mean an issue that's stopping you from having the very best health possible. And the only difference with a need is something that it's stopping you having the very best health, but it's also something you want help with. So for example, if I had radiation and I lost my hair, to me that would be something that I would want help with, to get a wig or something else. But if you took my partner, for example, who has very little hair to start with, it might not be something that he's concerned about. So this wouldn't be an unmet need for him. It's also really different from satisfaction with care. If you're in the last session that I was in, we were hearing how car parking at the hospital is something that was always determining whether people are satisfied with their care. And the thing is, people tend to be really satisfied with the clinicians they're seeing and the clinical care that they receive. And we're not saying that that care isn't excellent, but people also tend to have physical and social and family and work and different parts of their lives affected by brain tumours, and we're interested in understanding what those needs are so that we can try and improve services to help meet people's needs. And needs also depend very much on the services that are available. So I'm from Queensland, and a lot of the research I've done has been in Queensland with people from both the metropolitan and the rural and remote areas. And as you would expect, there's less services in the sort of more remote areas, and so people tend to have higher levels of unmet needs, particularly around things like actually getting to appointments and things like that. So what needs people are facing very much depend on those services. So what do we know about the unmet needs of people affected by primary brain tumours? Well, my interest in this first started back with a study that was done with group and individual interviews with patients and their families who either had a brain tumour, a primary brain tumour, and it was any type of primary brain, so whether it be benign or malignant, and any time since diagnosis. So there are some people in this study who were only a few months since they were diagnosed, and others who were sort of 20 years. And the aim of this study was to look at the needs that people had, any support services which they thought would have been helpful, and any experiences which they'd had of discrimination. So we found 7 main areas of support. And the first was that people said that they needed some sort of support and they couldn't really name what the support was that they needed. And I guess that's because generally when you're diagnosed with a brain tumour, you've never been diagnosed with one before. So you sort of don't have that experience to go, this is what I actually needed. But it's still quite interesting to know. People did say, yes, I needed some help. The second thing was information and help to cope with uncertainty. One thing that I'm sure everyone here is aware of is that often you need to start treatment very soon after you're diagnosed. So, if someone goes into an emergency room with having seizures and they're then told, okay, you're going to have surgery, within a week, there's not a lot of time, but you need to get a lot of information in that week to decide what you're going to do. People spoke really strongly of wanting a designated staff person, and I guess that's one of the reasons it's so great to hear that the Cure Brain Cancer Foundation is advocating for neuro-oncology nurses so that they can be that central point of contact, so that people can go to them for medical questions, for practical help, and later on through treatment and recovery to say, what should I do about this symptom? People needed help to prepare for imminent changes through treatment, and this was something that was often brought up by family members. And even though it's a really difficult issue, people were saying, well, in case something happens and the patient has a temporary or a permanent incapacity after, what do we need to do in terms of getting an endura powering of attorney, or what do we need to do in terms of getting a will? And they didn't really know who to talk to about this or what to do, and no one wants to upset someone by bringing it up unnecessarily. So this was something that was brought up. And the last thing was the technology to obtain information and support. So people said, I'd love to be able to have a phone number or an email or something I can call, I can talk to someone if I have questions. But at the same time, people who'd used the internet, a lot of people said it was overwhelming and it was highly distressing. So it was sort of, a bit of a mix of good and bad. Another theme that came up was the need for practical support. So people told us that they really were relying on their friends and family, particularly in that early period when they were being diagnosed and having their first treatments, and not so much relying on sort of formal, nursing services or home-based services. And people said they really wanted help to deal with the financial issues and, deal with government agencies like Centrelink to deal with that bureaucratic maze that makes it so hard to even find out if you're eligible, let alone to actually receive assistance. People wanted help to return to their pre-treatment responsibilities. So if you were going to get back to work, perhaps having some form of cognitive testing to work out if you had any limitations and help to get around them. Or if you're actually someone who is going to need more ongoing help, to look at, what did you need to do to access this? Help to deal with social isolation and organised respite care. And social isolation was something a lot of people mentioned in terms of, for example, that their friends or their neighbours or whatever didn't know how to approach them. Like, should I, be worried? What should I say? And, also for people who needed it, how do you access respite care? A smaller group of people said that they wanted help to overcome stigma or discrimination. And this was something that particularly came up from parents of children with brain tumours who said they were concerned that maybe their child was going to be looked at differently if they were termed disabled, or that they wouldn't necessarily get the most educational opportunities. And that they felt that maybe teachers or government agencies didn't have a terribly good understanding of what the impact of a brain tumour would be, and there were some potential restrictions on the person's ability to access opportunities. Then the final thing was about help to discuss potentially reduced life expectancy. And although this wasn't relevant to everyone that we talked to, some people, particularly the family, said that this was such a difficult thing to talk about, and they really had no idea who to talk to about it. So this was work that was published back in 2006, so I think we can actually see that there has been quite a bit of progression since then. I was listening earlier to some of the great work the Cancer Institute New South Wales was saying they provide now to address some of this, so it's good to see it actually moving forward. The next thing we did was to look at how important these needs were. So, is this relevant for a large number of people, or is it only affecting a few? So for this, there was a survey done, and it was sent to everyone who's subscribed to what at the time was the Queensland Cancer Fund, now the Cancer Council Queensland, their brain tumour support service. And 75 patients and 70 family members responded to this. And again, it was people with any type of primary brain tumour, any time since diagnosis. And the aim of this was to look at what were people's most significant needs, what services people wanted to address them, and so what we could do about them. And I just thought I'd bring this up. This was the 5 issues that people said they most needed help with. So when I said earlier with needs, it's something not only you need help with, but you want that help with. So this is just the percentage of people said that they had moderate to high unmet needs. And you can see, it was 2 in 5 people said that they had a need for that lack of energy or tiredness, the uncertainty about the future, not being able to do the things you used to do, changes in mental or thinking ability, and the physical side effects from the tumoral treatment. And then people in this survey were, up to sort of 20 years since their diagnosis, and we still had, 2 in 5 people. It's quite a significant number of people saying, hey, I would like help with these issues. And among family members, we had a bit of a mix. So again, it was almost 2 in 5 for the top 5 items, and a mix of issues that were relevant, to both caring for the person with the brain tumour and caring for, the family person themselves, who's also affected by, the stress and the financial pressure and everything else. So, things like addressing fears about the patient's physical or mental deterioration. So after this study, I decided that for my PhD work, I was going to focus on information needs. Now, I'm sure we all know, why information is so important. We need it for psychological adjustment to help us, feel more in control. We need it just to sort of be able to say, yes, do the surgery or radiation or chemotherapy, to participate and decide what treatments we're going to have. We need it for our continuity of care, so that, when you see multiple health professionals at multiple hospitals, that everyone has the same information, everyone knows how to treat you appropriately. And, for family members, how do we care and support the person with a brain tumour? So I did a review looking at what are the issues affecting people in terms of information at diagnosis. And I'm sure that this will resonate with a lot of you here. So firstly, when you're diagnosed, it's a period of high stress. So it's really hard to take in all the information you're given. Something that echoed what we found in the interview study we did is that treatment was often initiated really soon after people were diagnosed. They didn't have a lot of time to take everything in. I think people are being, nowadays compared to sort of 20 years ago, they're being discharged from hospital sooner and sooner. So you don't have, 3 weeks to get used to things and recover a bit and take everything in. Now, you're often home within a week and care is provided outpatient. So, we're having to give all that information a lot sooner. And the other thing is that people said to us that they really wanted information provided proactively. So, for example, issues about, these are symptoms you might experience before that you then get that symptom and go, oh, I didn't know that was going to happen, or, this is a complication that may occur, or these are changes that might happen to your cognition. So people just wanted some detailed, practical information about recovery and what was going to happen in the future. And at the same time, there's also this sort of need to avoid too much. You don't want to overwhelm people, give them too much information too soon and more than people want. And I think, no one wants to take away hope, but at the same time give people as much information as they need to decide what they're going to do. So I then looked at how well is information provided. And overall found that generally in the literature, it seems that information provision hasn't been terribly sufficient. So patients and family members were tended to be not satisfied with the information provided, and they said that the information wasn't coherent and cohesive. And this was particularly for the non-acute issues. So people might say, okay, I understand that I might need a blood transfusion while I'm in hospital because of the surgery, but I wasn't aware that when I got home I was going to be incredibly fatigued. So these non-acute issues were less well explained. And people said they didn't feel as prepared for the future. So, that they might be sleepless, or that, they might have difficulty with their thinking. Information also wasn't well understood, and I think this often comes down to just how we communicate as patients versus as clinicians. So, understanding your diagnosis, a lot of people in the studies that we were looking at weren't fully aware of exactly what type of brain tumour they had or what their long-term prognosis is. And we're not sure if this is because actually for these studies, particularly those done 10 years ago, it's if these things weren't as well understood. But still, it seems that the patients in these studies were saying, we're not really sure what's happening. And the other thing is just the term. I'm sure everyone here is more familiar with the term glioma because they've heard it so many times. But when you first hear it, you don't necessarily understand what it means. It's not necessarily explained as well as it might be. And successful surgery. So a successful surgery to a surgeon might mean you didn't need any blood transfusions. But to a patient, they might think, well, does that mean you got all the tumour out? And so, we just need to sort of see that when we're talking to clinicians so we can understand what the terms mean. And then across studies, there were needs that 30 to 60% of patients said were unmet for information. And these are generally about things like the information about illness in terms of the psychological and the practical issues and treatment, and also a need for information about symptoms, particularly managing them at home. So something that I decided to do in my PhD work to try and overcome this was to develop a question prompt list, which is, I'm just going to refer to it as QPL, but really it's just a fancy way of saying a list of questions. And so this is just a list of questions that people might want to ask their doctors about, the sort of problems that they might experience having a brain tumour. And the idea is that this assists people to express what they want to know. It's been done with some other populations like, people seeing a surgeon or people just with cancer generally. And they've generally found that, it gives people that, okay, I can ask this question, other people are interested in it, it's not a stupid question, and it helps people to actually ask questions. And they've done a few studies where they've actually recorded consultations with doctors, and they found that patients who are given QPL actually ask more questions and tend to get more information than patients who aren't. But this hadn't been previously developed for people with primary brain tumours, and we saw that the ones that were developed were quite generic and not really asking the sort of questions that people want to know with this. So we decided to develop one. And so we did a whole bunch of things to develop it. We looked at all existing resources, existing brain tumour materials. We did a lot of interviews with patients and their families and health professionals. We looked at the readability to make sure it was really clear, and we did a lot of redrafting. So every time we got feedback, we redrafted again to try and get this to be suitable. Now, I just want to show you the main topics of the QPL we developed. So there's 7 main topics. So, diagnosis, prognosis, symptoms and changes, treatment and management, after treatment finishes, support and the health professional team. And so within each of these is a whole range of topics. So for example, we had questions written with diagnosis about exactly what sort of tumour it is and where is it in the brain. Within the after treatment finishes, it was about things like how do you plan for your recovery and what can you do yourself to help yourself get well. And so we developed this with the idea that these were questions that the patients and their families themselves had been saying. We tried to use people's words wherever possible. That they wanted to ask a doctor, or they had asked a doctor, and it helped them get the information that they needed. And so this is just a copy of the resulting QPL that we developed and then tested. So I don't know if you can actually read it at the back, but some of the questions are, what are the chances of curing my tumour? Or, is how I'm feeling at the moment normal for my condition? And so this was sort of some of the questions in it. And I do have some of the booklets here if anyone would like to have a look afterwards. So we then did a test of the QPL to see, if people actually found it useful. And we compared to a standard information booklet about brain tumours. Now the thing about the question prompt list is it is just a list of questions. It doesn't have information, answering the questions. The idea is, because a lot of the answers are going to be really specific to your situation, the idea is ask your doctor and get, the individual answer for you. But we thought the best thing for us to compare is just, an information brochure. So we asked people, did a whole range of questions about whether it was helpful and whether it actually helped them to ask questions. So we did this with 20 patients undergoing treatment at 2 private and 2 public hospitals in Brisbane. And this is just, I don't know if this is going to be a bit too small to see, but this is a bit of a graph of some of our results. So the blue is where people have said they agreed completely, and the green agreed somewhat. So you can see everyone said that they found the brochure to be helpful, that it made it easier to ask questions, that questions that were useful to them. We did have one person who said they still found it overwhelming to read, which really shows us that information, it's not a one-size-fits-all, that some people will find this overwhelming. But almost everyone said they thought the brochure would be useful in the future and that it was easy to understand. And we also asked people if they actually used it to help them ask questions of their doctors, and we found, 2 people said they asked questions of their neurosurgeon, and 4 of their radiation oncologists, 5 of medical oncologists. So it did seem to help people to think of questions they wanted to ask. And we also had a lot of qualitative comments that people said, yes, this actually helped me. I found it easy to understand. It helped me to talk to my doctors. So overall, we found that this was acceptable to patients. They did seem to find it helpful. Had useful questions. We asked people if it was too short or too long. They tended to think it was the right length. It did prompt them to ask questions, and it did actually mean that they tended to get more information. Excuse me. But it still may be overwhelming for people. And we expect that, it is really overwhelming to get information about, your disease and treatment. So it might not be about the question prompt list itself, just the situation, but this is something we think might help. I did want to mention that we do have the question prompt list available to anyone who wants it in hard copy, and it's also available online. So I'll have my details up on the end if anyone wants to contact me. So I thought I'd just briefly talk about what I'm doing now and in the future. So we've recently been looking more in unmet needs. About how this varies with services available. So something we know is that, your needs depend on what services you have available to you. But what we don't know is what services are people actually using. So there is, some data from, an institute such as the Cancer Fund might keep data on, how many people contact them and what they do. But there isn't good information on the whole range of services available. So we've actually just finished a study looking at, what are people aware of? What do they use? Why do they use it or not? If people don't want to use a social worker, or they do want to use a psychologist, or, why or why not? And what would be most useful to you? And then the next step we're doing is looking at how we can better support family members of people diagnosed with primary brain tumours. And for this, I really want to make sure that we can try and reach people outside just the metropolitan areas. So we're really looking at what we can do in terms of providing resources online or via mobile phone. So that's sort of, I guess, our next step. So we're really hoping that the research we have done is leading to better services, that by understanding what people's needs are, that we can try and design services that can meet them. And I'm always welcome if anyone wants to send me an email or a phone call to hear more about how we're getting it right or wrong, if you think we're not understanding your needs. So thank you very much. Any questions?
Yeah, any questions?
Would you send the books out if we ask them?
Yes, definitely. Yes, I have some here today I can hand out, or if anyone sends me an email or phone call, I can send them to you. So.
Thank you very much. Those booklets sound very, very useful. The particular one about tiredness and fatigue,
Yes.
and that's very interesting. It's been my experience that that's common across all sorts of patients, all sorts of treatment. Some who've had minimum treatment, some who've had maximum. I'm not sure if you can expand on that a little bit more.
Well, something we know is that fatigue depends not just on the treatments you've had. So it can depend on, like it's a whole intersection of a wide range of things. So we know that people who've had, when you're having radiation treatment, particularly toward the end of the radiation treatment, people tend to feel really tired and get that sleepiness, that drowsiness. But we suspect that there's a whole range of other factors involved. So, and these might be genetic factors, these might be sort of psychosocial factors, and it's a real intersection. So I know there have been some interventions designed that try to help people overcome fatigue, some of which involve things like pacing or exercise, which I've got to say, when you're tired, the last thing you feel like is exercise, but there has been some success with it. But I think it's still really not well understood. We can't sort of say because you have, this treatment or you have this type of tumour that you'll be more or less fatigued at this point. Yeah, sorry.